Alrighty, we're live. Alrighty, first question. Can you do a mini lower facelift / neck lift if you have about an inch of looser skin below your ears?
Okay. Hey guys, Dr. Ardesh here, double board certified facial plastic surgeon. If I heard the question correctly, if you have an inch or so of loose skin below the ear, can we do a mini facelift or a mini neck lift? And the absolute answer is yes. Mini facelift, mini neck lift, these are great ways to actually tighten the underlying muscles and also remove some unwanted skin and wrinkles we have of the face. So the term mini is mostly just referring to the fact that there's not a lot of fullness to the patient's face. So if you have someone who has a very massive or full neck, lots of wrinkles, which is typically happening more in the ages of 60s, 70s, these patients are not candidates for a mini facelift. Mini facelift candidates are typically patients in their mid to late 30s that are going to go into their 40s and 50s, as long as there's not a lot of fullness. But what we do is we make a limited incision, which is hiding inside the ear canal and behind the ear, and we're able to tighten up the muscles of the face and define the jawline really well, and then also remove any saggy skin. So if there's an inch or so of skin, we definitely can remove that and help rejuvenate the neck and the face. When I'm doing these procedures, what I really try to improve for my patients, the goal for me is always to clean up all the loose and saggy skin underneath the chin, and then also address the jowls, which are these little bags of fat that hang down here, and then create a nice defined jawline. So I hope that answers the question.
Perfect. The next question is, can you graft fat from chin liposuction into the nasolabial folds and lips?
Okay, so the question is, can I transfer fat from underneath the chin or the neck fat into the melolabial folds or into the lips? The answer is yes. So when we do neck liposuction, or if we do a short scar neck lift, which is made through a little incision underneath the chin, there's a lot of fat underneath the chin, which is what's creating that double chin look. And so I can remove that fat, and that fat can then be processed, and we can inject it to the folds or to the lips or wherever we want. Normally, however, patients who are getting this procedure done, there's not a lot of fat that in this area that we have to totally fat graft the whole entire face. That's why normally when we're doing fat grafting to the face, I harvest the fat from the abdomen, I harvest the fat from the butt or the thighs, but certainly we can always move fat from one place to another. And as long as there's enough, we can do the procedure.
Perfect. Let's see. Any other questions?
Any questions?
Yeah. Will buccal fat removal help make a face appear more symmetrical?
Buccal fat removal can help a face look more symmetrical if most of us all have asymmetries to our face. There's very few faces that are perfectly symmetrical. So if a person has some asymmetry in their midface, which is the region right in here, kind of between the eyes and the upper lip, in that area, we could definitely use buccal fat removal to make the face look more like either the right side or the left side of the face. We would probably not remove the same amount of buccal fat from both sides, or we may just choose to remove it from one side of the face and not the other. And then with some additional fat grafting, possibly some facial implants such as jaw implants on the sides, chin implant, cheek implants, we're able to achieve a more symmetrical appearance for our patients.
Who is a good candidate for buccal fat removal?
Who's a good candidate for buccal fat removal? Any patient who is looking to create a slimmed down appearance of their face, primarily in the area of their cheeks right here. So what I like to do is ask my patients when they first come in for the consultation to make a little bit of a fishy face. Now, I don't think it looks natural or good to make a complete fishy face like that. But when you begin to suck in air into your lips through pursed lips, and you're sucking your cheeks in, you start to see your face slimming down a little bit. And a buccal fat removal is able to achieve that goal for our patients. These can be patients in their 20s, in their 30s, who are really trying to slim down the face here, but it can also be a patient in their 40s, 50s, 60s. A lot of times in the older patients, the procedure is done in combination with a facelift. So I can elevate the cheeks, I can define the jawline, really clean up any loose skin or fat along the neck, but then slim down this area right here. A lot of times we also do this, the buccal fat removal, along with neck liposuction or face tight procedure. So Dr. Emer typically does the face tight, and that's going to give really good definition to the face and to the jawline and the neck. And then what I do is I slim down this area right here. And what we're trying to do is highlight the cheeks, bring down this area and slim it down, and then really define the jawline for our patients. So hopefully that answered the question.
Who is a good candidate for rhinoplasty?
Good candidates for rhinoplasty are anyone who has any concerns about the appearance of their nose. So there's noses come in all shapes and sizes, and primarily most people are looking to reduce the size of their nose. So a more simple rhinoplasty would be to just remove the hump of the nose, and this can be done through a scarless procedure where the incisions are all on the inside of the nose and there's no scars at all on the outside of the nose, or it can be done through an open procedure. So the difference between the two procedures is a closed rhinoplasty is more for just bumps on the nose, maybe add a little bit of tip definition to the patient's nose, maybe narrow the nose a little bit. But if there's a lot of work that needs to be done for the tip of someone's nose, or if there's a lot of crookedness to the nose, these need to be done through an open approach. So any patient who really doesn't like the appearance of their nose would be a great candidate for a rhinoplasty. And the other question is, who's a good candidate for a liquid rhinoplasty? Liquid rhinoplasty patients are typically ones that just have little minor issues, and sometimes they have a small subtle hump, and what we can do is we can camouflage the hump by applying some filler along the bridge of the nose. This is a temporary fix, so they will need to get the filler reapplied about every 1 to 2 years. We can also use some Botox to actually change the appearance of the nose some as well. But typically the patients that are undergoing liquid rhinoplasties are ones that have very subtle minor things that they're looking to change. If a more permanent and significant difference needs to be made, these patients will require a surgery.
When do you feel like Botox is a good time to be done? Is it true that Botox will stretch your face over time?
That's a great question. So when do I feel like Botox should be done? Well, if the question is asking at what age someone should begin doing Botox, it can really be started at any age, but I get a lot of consults that come in asking if Botox should be done for prevention. Typically, most people start to form wrinkles in their face in their late 20s and in their 30s. So the idea of a teenager doing Botox to prevent any wrinkles to form in their 30s is, I don't know, it's a little too far-fetched for me to accept. So typically, I tell patients whenever they start to see wrinkles at rest, they definitely need to start Botox. So if you're just looking at yourself in the mirror, you're not raising your eyebrows, you're not making any angry faces, you're not making big smiles, and you start to see deep lines forming in your face, well, Botox will be a great solution for you. However, when you raise your eyebrows or when you smile, we all have little wrinkles that form in our face. If you're looking to reduce those wrinkles, certainly we can do the Botox at a younger age, but primarily most patients come in their late 20s or early 30s. Definitely then, as we age, those wrinkles are all becoming more significant, so you want to maintain your Botox about every 3 to 4 months. And if you're not doing it that frequently, you're going to start seeing the wrinkles back.
After kybella for submental fat treatment, can fat return and deposit there again?
So the question is, after kybella, for treatment of the neck and removal of the fat or the double chin, will that fat come back? So that's the greatest part about kybella, is that kybella, when it removes the fat, it completely melts away the fat and it's permanent. So that fat is not going to come back. So it's a little bit different than when we're doing liposuction and we're removing the fat. The surrounding fat, a lot of times, if the patient is going to gain weight, can also gain back that fat, or it can appear like that fat is coming back. With kybella, it is permanently removing the fat and actually bursting these fat cells so they don't come back in the area underneath the chin and even out to the lateral neck. I'm also using kybella in other parts of the body, which I'm using to treat bra fat. I'm using it to treat kind of the fat over the knees, sometimes some fat around the abdomen. And once this fat is gone, it's not going to come back. However, a lot of times, as our patients age, as my patients age, they may still require some other procedures in addition to kybella to get them the look that they're looking for, such as if someone's had kybella years ago and all the fat is gone from underneath their chin, they may still need some tightening from behind the ears in order to get them a well-defined jawline and a well-defined neckline.
What is the best approach to treating significant volume loss in the cheeks?
There are multiple approaches to improving and increasing volume loss to the cheeks. So it can be as simple as just in-office fillers. We can use the Juvederm products such as Voluma. We can use Velour. We can use the Restylane products. They all work great. Radiesse can also be used. However, there are other options as well. I really love fat grafting. To me, fat grafting is one of my favorite procedures to perform. Fat feels natural, it's soft, it's living tissue, it's part of you. So it's a little different than having filler applied in the office. It does require going to the procedure room or to the operating room, and there is some liposuction that's involved where we remove the fat from the thighs or from the abdomen or the butt, and I have to process the fat and then apply it to the cheeks. But it helps improve the texture of the skin. It makes the skin glow a little bit more. There's medical studies out there that have shown this. And it's also just giving it has a nice feel to it. I also love putting fat in the lips and elsewhere in the face because, again, it's just natural tissue. It's your own body. So there's fat. There's also implants. So if a patient wants to just increase volume in the cheeks and they don't have a lot of fat on their body, or they just want a more permanent solution that's quick, it would be placing implants in the cheeks through incisions underneath the lips. So those incisions are not visible at all. Lastly, just the facelift. So a mid-facelift or a facelift, traditional facelift, is actually going to elevate the cheeks and restore volume to the face. Typically, though, in a lot of patients, they still require more volume, so I do combine a lot of fat grafting with my facelift procedures, or after the surgery, they can come and get fillers in the office.
I'm starting to have more smile lines. What is the best way to address those without Ulthera or filler?
So smile lines. So the question is, the viewer is asking about smile lines, and as she ages, I'm assuming she's seeing more. So if you go back and you look at photographs of yourself as in your 20s or as a teenager, typically most people have smile lines. But what happens is, as we age, the ligaments that are holding our face up, they start to become loose. And as they become loose, the fat pads in our face, they start to sag. And as everything starts to drop and gravity is not helping, it's forming a little shadow. It's casting a shadow over our laugh lines or our medial labial folds. And what's going to happen is you're going to look a little more tired. So what we like to do is, filler is a great way to really fill in these areas. We can use Juvederm products such as Velour, just plain Juvederm Ultra. We can use the Restylane products. These all work really well. We can do fat grafting, but also just realize at some point, if things have dropped down way too far, you are going to need a little bit of a lift to kind of get the look that you're probably looking for. So it's a combination of a lot of techniques. Then we can also improve the quality of the skin. So microneedling, lasering, all of these things are going to help rejuvenate the face and make things look younger and more youthful. And I think you're going to like the look that you get from that.
Awesome. Let's see. One last question.
Okay.
I'm really interested in sculpting my chin and jaw area. I have pretty chubby cheeks as it is. What would be my best option?
Okay. So the question is, the patient is concerned about some fullness, some chubbiness to their cheeks and face, and they're looking to sculpt their chin and their jawline. So honestly, the honest answer is you need to come in for a consultation. We can do a virtual consultation, we can do an in-person consultation, but typically for more of a full figured face, we are looking to maintain the fullness in the cheeks. If there's not fullness in the cheeks, we can use fillers or we can use fat grafting to add volume to the cheeks. A lot of these patients with fuller faces benefit from the buccal fat reduction. So that procedure, we're going to be removing fat from this area of the face, so it's really going to slim down the face. And then lastly, to really improve the jawline, what we like to do is you might require a chin implant, you might require implants on the angles of the jawline. That's typically a procedure that we do for men, but it's going to give good definition to the jawline. And we like to combine this a lot of times with Dr. Emer performing the face type procedure.